Okay, hi everyone. Hi, I'm Ming Hui from the Center for Health Activation. Or CHA. So CHA is hosting today's health talk. So before we start the health talk proper, we can just go through some house rules. Because today's health talk is hosted on the Zoom webinar format, so you will not be able to unmute yourself or to turn on your camera. So if you have any questions about today's topic, please feel free to type them into the Q&A chat box at the bottom of your screen. You can type them anytime during the session, and then our speakers will answer the questions during the Q&A session at the end of the talk, or they will type the answer during the talk. Yeah, so also we will have an online survey form at the end of the session. So please do fill it up to give us your feedback on today's session. Okay. Okay, so today we have with us Senior Staff Nurse Nabila from Tan Tock Seng. So Nabila specializes in geriatric care, and she will be sharing with us on the topic today, which is understanding dementia in the elderly. So without further ado, I'll pass the time over to Nabila.
Okay, hello everyone, good afternoon. Yes, my name is Nabila. So I'll be your speaker for today. I am specialized in geriatric care. So for today's topic, it's actually quite intriguing. We will be discussing about understanding dementia and how to manage person with dementia. So the content for today will be, okay, so this will be the content for today. Okay, so before we start, I'll be showing you a short film to help understand better about what a person with dementia feels or experience. Okay, so I just play the video. Okay, can. So that's a video about a little bit about dementia. Okay, so what is dementia? As you can see from the video that the lady showed signs and symptoms of memory loss, difficulty explaining herself, and then problem solving such as finding her way back home. A person with dementia may experience these signs and symptoms and other thinking abilities that are severe enough to affect their daily life. Dementia is also often referred as senility or senile dementia. It is often mistook that serious mental declining is a normal part of aging. So dementia is not part of normal aging. Okay, so moving forward, I'll be sharing with you some statistics of how common dementia is in Singapore. So 1 in every 10 person aged 60 years and above has dementia in Singapore, and for 1 in every 2 person aged 85 years and above has dementia. So at present, there are about 45,000 persons with dementia, and it's projected to increase or double in this figure in the future. So it's actually quite common, dementia is actually quite common in Singapore. So as you all know, dementia is an umbrella term. There are a few types of dementia, and the most common one is Alzheimer's dementia, which takes up about 60 to 80%. Then we have vascular dementia, which is 20%. And then we also have dementia with Lewy body, which is 10%, and the remaining 10% has other types, such as frontotemporal dementia, Parkinson disease, normal pressure hydrocephalus, and also mixed dementia. Okay, so now I explain to you a bit more about what is Alzheimer's, which is the most common dementia. So scientifically, Alzheimer's are caused by protein build-up around the brain cells. So this protein damages the brain cells, which results in interference of the brain cells to communicate with each other. So this will affect their thinking, behavior, and also feelings. So the signs of dementia usually starts out slowly and gradually worsen over time. And then the second most common dementia is vascular dementia. So it's actually caused by disruption of blood flow to the brain, such as stroke, which damages the brain cells. Yes, so the changes in thinking skills sometimes occur suddenly or a few months after the stroke. The following factors that I'll be sharing will increase your risk of heart disease and stroke, and then increasing your risk of vascular dementia. So the following factors such as diabetes, high blood pressure, high cholesterol, and smoking. Okay. So who are at risk of having dementia? So the factors that I'm about to list may differ from person to person. There is also no single cause of dementia, rather a combination of multiple factors such as ages, 65 years and above. You have your family history, traumatic head injury, stroke, Parkinson disease, poor health, such as your high blood pressure, high cholesterol, diabetes. You have unhealthy lifestyle such as obesity, smoking, excessive drinking, and also a sedentary lifestyle. So now I'll be sharing with you about the signs and symptoms of dementia. So there are about 10 warning signs to take note. So the first one is memory loss. So your loved one will show signs of forgetfulness as simple as the date or time. And then difficulty performing a familiar task such as like counting money, switching off the light, turning off the stove, or even forgetting to lock the gate. And then we have problems with language. For example, they might have difficulty finding the words to explain themselves. We also have a disorientation to time and place. Your loved one may forget how to find their way back home. And then poor or decreased judgment. This one usually it increases the risk of fall also. So for problems of keeping track of things, for example, if they used to pay their own bills or take their own medication, they may also tend to forget about all of this. So we also have misplacing things and then changes in mood and behavior. Your loved one may tend to be more grouchy or more withdrawn from social activities. And then challenges in understanding visual and spatial information. This will also increase the risk of fall and then withdrawal from work or social activities. Okay, so now we move forward to the stages of dementia. So we have 3 stages of dementia. The early stage, which is also known as mild dementia, the individual can function independently with memory or concentration difficulties. They may be forgetful and tend to repeat themselves quite frequently. For the middle stage, which is moderate dementia, they will have greater difficulty performing routine tasks and communicating. Personality and behavior changes may take place in this stage. You will notice more changes in their behavior and memory loss. A caregiver is required to supervise or assist them at this stage. The last stage, which is severe dementia, they will lose their ability to communicate and control movement. A full-time caregiver in all the activities of daily living, such as bathing, toileting, dressing, and eating are required. Okay, so now I'm going to share with you on how do we manage and care for a person with dementia. So a person with dementia that has behavior symptoms commonly is accompanied by BPSD, which is a term called behavioral and psychological symptoms of dementia. So this this is a group of signs and symptoms of disturbed perception, thought content, mood, or behavior that frequently occurs in patients with dementia. So many of times we do observe that BPSD can cause great sufferings in patients and caregivers because it's not easy when they exhibit this kind of behavior. Okay, so the common challenging behaviors that a dementia person with BPSD can exhibit agitation and aggression. They have delusion, hallucination, wandering behavior, repetitive behavior, disinhibition, sleep-wake reversal, and also food refusal. Okay, so what are the common triggers of these behaviors? So usually, what triggers this behavior is that unmet needs, which, for example, like toileting needs, whether mom or dad is hungry or thirsty. And then we have discomfort, such as urine retention, constipation, pain, breathlessness. And then unfamiliar environment can also trigger this behavior. And then they have acute illness, also medication side effects. Okay, so I'll be talking more about certain behaviors such as agitation and aggression. So the strategies to manage this type of behavior is that make sure you assess their unmet needs, such as toileting. When was the last time that they went to the toilet? Then maybe you can provide some food for them. Maybe they are hungry, and then you can address their pain, ensure the environment is calm and quiet. You can provide reassurance to them, can allow them to express their feelings also. So when when they are trying to express their feelings, you can give them time and space, and then allow them to calm down, and then provide personal space for them. So usually when they are agitated, they might just want to be alone. So yeah, you can just provide them some personal space. After they have calmed down, maybe you can distract them with activities, and then you can play some music therapy for them, touch therapy. And then when they are having this type of behavior like agitation, try to keep dangerous objects out of reach. Okay, so for wandering behavior, you can try to determine what is the purpose of wandering. Why are they wandering? Is it they want to go home? Is it they are looking for a specific person? And then you can allow, if they really insist on wandering, you can allow them to wander safely with supervision if possible. And then reality orientation, maybe you can just explain to them that, okay, so now you're at home, it's daytime, now we're going to have our lunch. Just reorientate them back to the time. So for you can also prepare some safe return card. So for this safe return card, you can indicate their name, their IC, their address, and then the next of kin's handphone number. So this is when, in the event that mom or dad wanders without your knowledge, the public are able to help them go back to their home. Yeah. So for hallucination and delusion, ensure that hearing and visual aids are within reach, and then try to validate their feelings. Do not argue with them, and then provide visual cues to guide them back to reality. And then you can also assess for any new initiation of medication, because certain medication certain medication has side effects that can make them have hallucination or delusion. Okay, so for food refusal, it's actually quite common for dementia, for a person with dementia to have food refusal. So we have the strategies that can be done is you can either encourage home cooked food, and then you can identify their likes and dislikes. For example, if they like pudding, ice cream, maybe you can just offer them, and then you can provide a variety of food for them to choose as well. And then when you provide them a variety of food, maybe you can try to prepare meals in small portions, because usually what we see is that if the meal is in a big portion, they will automatically refuse the food because they feel like they cannot finish it. Yeah. And then a lot of familiar face during feeding times, encourage snacks during tea time. And then when they refuse, try not to force them, give them time and space, and then you can try again later. Okay, so for problems faced when communicating with person with dementia, is that for hearing and visual impairment, it may be due to impacted wax or hearing loss. I can suggest to either visit the doctor or so to get it checked, and then to proceed with the necessary intervention, such as like the doctor might prescribe olive oil drops or assess the need of hearing aid. And then this is to promote better communication with person with dementia. So for short concentration, a person with dementia will have difficulty focusing, and then you can always redirect them back to the task or conversation. So for agnosia, usually they will lose this ability to recognize or identify objects or person. They will have difficulty finding words, used to speech that doesn't make sense, or inability to comprehend conversation. So writing and reading skills have declined. So for apraxia, which is loss of ability to carry out movements and gestures, so a person with dementia may be unable to perform cognitive gestures, and they might find it difficult or impossible to make certain motor movements even though their muscles are normal. Okay, so now I'm going to show you a short video on how to better communicate with a person with dementia. Okay. Okay, so as you can see from the video, they mention patience as it's important to give them time to process the information. So tips about communicating with person with dementia, I'll just summarize because the video did mention a few points that I'm about to share also. So make sure you set the right environment, use short and simple words. So when you use these simple words, try to speak clearly, slowly, and also firmly. So your tone of voice and body language is also important. Get the person's attention by maintaining eye contact as well. So knowing your loved one better is also a good tip. Make sure you know their dialects, their past events, and also validation therapy. So for validation therapy, I'll be explaining more to you. And then before that, I'll show you another video about validation therapy. Okay, so from the video, you can see dad was having delusion or hallucination about late mom, and then daughter instantly shut him out. Try to avoid doing this, and then instead try to go with the person. Avoid sending "you are wrong" message, and then validate their feelings in whatever time is real to them. So when this situation happens, right, try to focus more on the person instead of the situation. And then a person with dementia may respond in the moment, but unable to retain information. So now we're going to move on to how to promote better sleep at night. So this is to prevent sleep-wake reversal, where they sleep during the day and awake during the night. So try to maintain healthy sleep-wake pattern, such as a fixed bedtime and awakening time. So this is good, so that they will have a routine, a healthy sleep-wake pattern. And then try to avoid napping in the day. Increase daytime activities. For daytime activities, I will share more in the next few slides as well. So you can try to encourage exercise. Simple exercises will do. And then try to avoid caffeine, such as coffee, tea, soft drinks, or even chocolate after lunch. This is to promote better sleep at night, because usually in the hospital, we do limit caffeine intake after 2 p.m. And then try to limit fluid intake in the evening as well, because once they drink a lot of fluid in the evening, they may tend to go to the toilet at night even more frequently, and this will disrupt their sleep. And then try to create a conducive environment for sleeping, such as dim lights or play some soothing music. Okay, so these are some examples of activities that we do in the hospital, which can also be done at home. So for example, like cognitive, you can play some puzzles, you can create some activities such as puzzles, jigsaws, dominoes, mathematic games. So okay, so it's important to know that if they do this type of activities, it doesn't mean that they have to do it correctly. As long as they're engaging in the activity, is already good enough. So for creative, you can provide for them arts and craft, coloring and painting. So if you don't have any coloring materials, you can also use your phone, or if you have an iPad, you can just download those apps that they can color. Yeah. And then for daily life tasks, for example, folding laundry or sorting clothes packs, because these are activities that they have been doing for more than 20 to 30 years. So you can try to engage them in these daily life tasks. So for social, you can either print some reminiscence pictures, such as old Singapore, or old pictures of radio. And then you can either create a photo album of family members. Then they will start to story tell about all the family lah. And then for sensory, you can provide music, olden music that they like. For example, the one that is very popular, which is the Risateng. Yeah. And then for personal care, such as nail care or grooming, actually, for grooming, you can just prepare for them a small mirror. You can just give them a comb or a shaver. They will start to groom themselves. So this will also help them to boost their self-esteem. Okay, so I understand that caring for a person with dementia can be taxing, and caregivers may experience stress. So I will share with you the help and support available in the community. Okay, so for Dementia Daycare Center, it's actually a full daycare in a center-based setting for seniors with dementia. The services that they provide for seniors with mild to advanced dementia, they have group and individualized activities available. They also provide personal care and assistance with activities of daily living. So how do you apply this? You can actually approach the doctor at the hospital, or you can go to the nearest polyclinic that your loved one visits to ask for assistance to submit an online application. Alternatively, you can also visit the AIC link to apply for the application. Okay, so we also have dementia respite care. So it's a little bit more different than dementia daycare, because respite care is for short-term care options, such as when caregiver need to take a short break, or when the domestic helper is not available. So respite care is there to help caregivers. So how do you apply? Firstly, you will need caregivers will need to decide whether is it during weekdays or weekends, and then they choose a preferred provider from the list. So this list, you can actually get it from EIC website as well. Or you can also scan the QR code, which is on the right side of the screen, and then you can contact preferred providers, and they will advise you on the next steps. Okay. So for home-based services, they have home medical, where a doctor will visit you in your home and then deliver necessary care such as physical examination, and then review prescriptions of medication, and also offer appropriate medical advices. So for home nursing, apart from monitoring blood pressure and blood sugar levels, they can also provide caregiver trainings such as nursing care. And then for medical escort transport, it's quite straightforward. The service provides transportation for someone to accompany clients to travel for their appointments. And then for home personal care, the service is provided by trained care professionals to assist clients and their caregivers with activities of daily living, such as bathing or light housekeeping. So for befriending services, it's done by a group of volunteers from befriending services. They can help to take care of the emotional and psychological well-being of elderlies by helping them or listening to their problems. So how to apply? This is the same as dementia daycare. You can either approach the doctor at the hospital or a polyclinic nearest to you, or the one that your loved one visits to submit an online application. Otherwise, you can also go to the AIC website to apply. Okay. So for caregiver support group by Dementia Singapore, so for this support group, it provide an opportunity to respite, where you can meet other caregivers in similar situation, and then share with each other caregiving experience, and then learn about dementia and other practical tips as well. And then sessions are conducted in English, Mandarin, and Malay. The session is about 2 hours, and then it consists of a talk by guest speakers and sharing sessions amongst caregivers. So to register, you can either call the Dementia helpline, or you can either go to their Dementia Singapore website. Yeah. Okay, can. So we are almost coming to an end. So here's another video from our Tan Tock Seng Institute of Geriatrics and Active Aging on how to manage BPSD. Okay, so we have come to the end of the slides. Okay, so here's a take-home message. When you encounter challenging behaviors for your loved one, do find out about their unmet needs, and then practice dementia-friendly communication skills, and then try to validate how they feel. Try not to ignore their feelings, and then engage your loved ones with activities, and then practice good sleep hygiene. And also, I understand that yes, taking care of a person with dementia is not easy. So must also take care of yourself. Okay. Okay. So I've come to an end to the slides.
Okay, thank you very much, Nabila. Okay, now we are going to go into our Q&A session. So thank you for sending your questions in. We've actually received quite a lot of questions since the start of today's session. So if you have any questions on the material that Nabila has shared, please feel free to keep sending in more questions, and then our nursing team will try to take the questions. And if we have any questions that are not answered, we will also be following up with the answers via email after today's session.
Okay. And so I have received one question about frequent urination. Yeah, so usually frequent urination is caused by BPH, which is also caused, it's common in men only because it's called benign prostate hyperplasia. So there's an enlargement of the prostate, which may affect their bladder. Yeah, so this may cause frequent urination as well. UTI, which is urinary tract infection, can also cause frequent urination. And then we also have medication such as Lasix. If the doctors prescribe this medication called furosemide or Lasix, it may also cause frequent urination. And then frequent urination also can cause by worsening of the BPSD. So when a person with dementia has BPSD, they may have frequent urination as well. Yeah.
Okay, I will answer live. Nabila, can you help me mute yourself? Thank you. Okay, hi everyone, I'm Wan Ring. I'm the advanced practice nurse from Tan Tock Seng Hospital. It's my pleasure today to be here. And thank you, Nabila, our senior staff nurse Nabila, for the wonderful sharing sessions. I believe all of you have learned a lot from hers. And I do receive some of the questions as well, but maybe I'll just add on to what Nabila has shared just now. Some of our loved one with dementia, they do have, frequent urination. Sometimes it's very confusing. We're not sure whether are they having behavioral problems or is there any other thing else that can actually causing them to keep going to toilets. So I think firstly, most important, we need to find out, is there any urinary tract infections? I do share in the chat box. If you do notice, like for example, your loved one actually having fever, complaining painful urination, and you do notice there's change in color of the urine and there's some foul smelly urine that you do notice, please bring your loved one to see the doctors immediately. It could suggest a urinary tract infection. And secondly, like what she shared, drugs can cause it. And sometimes uncontrolled diabetes as also can give you frequent urination as well. Because your sugar is too high and the person tend to go to toilet frequently, it could be sign of high sugars. And on top of that, other things could be like what she has shared for male gentlemen, that possible in view of the age, and then their prostate can get enlarged. It can cause obstructions to the urethra, all this, and then it can cause them to have frequent urination. And I do notice that one of our audience actually shared that her father actually seated on the toilet bowl for quite a long while, 20 minutes. Possibly, we need to ask more about that because I only based on what he has shared with me, keep going to toilet every few minutes. So firstly, we need to find out, is there any urinary tract infection? Also, sometimes constipations can get, causing them to retain the urine. So what we can do for this is, if there's no sign of urinary tract infections, probably if you think that it's due to his behavior, if he's known to have this kind of frequent urination behavior, what we can do is we can actually, have a good bladder hygiene lah. So we can actually encourage our loved one to, limit their fluid intake after the 7 or 6 p.m. so that can reduce their nighttime frequent urinations. And also we can pot them, schedule a regular potting hours, pot them every 2 to 3 hours. Sometimes if the urine frequency is very, very long, we can actually slowly elongate the times. Like for example, 5 minutes, after that you drag it longer to 10 to 15 minutes and slowly to train the bladder. But if you realize this problem actually causing an issue, I would strongly advise you to seek for the medical treatments, because if it's caused by the prostate problem, I think urologists can help with it. They can order some medications to help to relieve the symptoms. And a lot of times, once they take the medicines, they can actually see a significant improvement from that. And your loved one will be more comfortable as well. Okay. And moving on, I do have one of the audience actually asked, how can we diagnose a person with dementia? Okay. And I do see a lot of questions about, some of the memory issue lah. For example, forgets to, keep asking repetitive questions. And some of the audience asking, is it, sign of dementia or not? And some of them actually asking, they notice like the person keeps sending the email, but without any attachment, and keep sending the repetitive email. Yeah. So firstly, how can we diagnose dementia? Actually, it's a very we need to go through a lot of detailed assessments lah. So that's why when just now Nabila shared with you all about what are the common signs and symptoms that we should look out for, that likely suggests that your loved one have dementia. So I believe all of you have listened already. For example, forgetfulness, misplacing things, and then asking repetitive questions. So when you bring your loved one to go and see doctor, so usually how doctor diagnose is they will usually ask you a set of questions, asking how your father or your mother or your loved one, how they, day to day, how they behave at home. And they will ask about some of the questions that can suggest of forgetfulness. They also will ask how's their day-to-day activity. Does all this forgetfulness that actually impact their activities or not? For example, they forget to take medicines, they forget, how to travel. They used to be able to travel with the public transport, then nowadays they are able to. And some of them might ask you about how they manage their finance as well. Yeah, so these are the history that the doctor will usually take from you or your loved one. And other than that, of course, this is just subjective data. We need some objective findings. The doctor also will do a set of cognitive screening tests. Some tests we call abbreviated mental tests, or tests that to assess the cognitive function, and it will based on the findings to see whether is there any sign of dementia as well. Of course, they also will do some blood tests. And lastly, brain imaging sometimes is needed to further evaluate the brain structure as well. The reason why they need to do this thorough screening is there's certain condition that can actually mimic dementia. Okay, so doesn't mean that you have forgetfulness, you have some memory issue, then you have dementia. The doctor have to do a lot of her work to make sure it is dementia. So why I say so is, for example, depression can mimic dementia. And aside from that, people who had stroke, after the stroke, they tend to, because the brain actually damaged before, and then their memory might be impaired for a while. And beside this, sometimes our thyroid level is low. It can also causing memory impact. Some vitamin, for example, B12 deficiency can also affect the memory. Other than that, of course, the doctor have to ask about whether this memory loss or is it acute or not. It just happened within weeks or days. It could be sign of acute confusion. In short, we call delirium. Then this is the time the doctor have to do a lot more screening to find out is there any infection ongoing, which actually causing these persons to get confused. and whether is there any electrolyte imbalance, meaning like your body, the minerals is imbalanced that causing memory impact. Sometimes they also will do other things like, for example, sugar check, because sometimes sugar low or high can causing confusion as well. Okay. And of course, they will do some physical examination for your loved one also. Remember, whatever their assessment do, right, they usually need to pair with the history from all of you. Sometimes your history is also quite valuable to them as well. And usually the short-term memory history, we have to say that it must be at least 6 months and above. Okay. 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 One of our audience actually asked whether is it necessary to go for routine, cognitive or like brain test. Yeah, actually the brain test, right? Actually, I'm not sure what is the outside the committee actually offer, or some of the GP that actually offer. But but my advice, if you do realize if any sign of like symptoms, memory impairment symptoms that you or your loved one that you seen on you and your loved one, that's a time you can actually seek for the medical treatments. However, routine screenings, right, might not need to lah. Okay, I do have one audience actually asking, beside like depression, stroke that I mentioned, is it true that dialect ethnic groups higher rate with dementia? There is I wouldn't say like there is no particular groups or dialect speakers will have a higher rate of dementias lah. Okay, because everybody, as long as you are 65 years old and above, if your lifestyle is unhealthy, like what just now Nabila has shared, you are actually posting yourself to have higher risk of dementia as well. Yeah, so I do not know that there's any particular groups that actually have higher risk of developing dementia. Okay, I have one audience actually asking, I think he shared that his father, who has been diagnosed with dementia, appear that having some behavioral issue, which is like food refusing lah. He only eats half hour later and then refuse to do essential tasks such as sitting properly and always sleeping and refusing to learn how to use the phone. And sometimes he felt that not sure is it part of the dementia that actually causing all these behavioral problems or not. Maybe I get Nabila to share about this. Yeah, maybe Nabila, you want to try to answer these questions? Yeah. Maybe you can share with them, let's say they notice that there's some problem with food refusing, and then also there's some difficulty to engage the fathers lah. How would you advise our family members?
Okay, thank you, APN One Green. Okay, so the question is about food refusal, right? Because earlier on, I did mention in the slides regarding food refusal. Because usually, if they refuse to eat until half an hour later, I feel that it's okay. You can just wait first. Okay. So sorry. Okay. So usually, if they refuse to eat, maybe you can just let them. Okay. If they refuse to eat, try not to force them. Try to give them time and space first. Let them calm down, and then you can try again later. And then you can either try again later, and then maybe with the food, if let's say you're giving some food and then they refuse, maybe you can try to ask them, okay, what is it that you like to eat? Maybe you can offer them some other alternatives to encourage, to improve to open up their appetite lah. Okay. Yeah. So other than that, maybe, okay, for example, if they don't want to take a big share of food, you can also provide them in smaller portions, or maybe give them alternatives such as like ice cream or pudding. Yeah. Can find out more about what do they like. Yeah. Okay. Okay, so about sitting, refusing to do essential tasks such as like sitting properly and then always sleeping. Okay, so for always sleeping, like I mentioned again, maybe you can provide some daytime activities to help them to keep them occupied during the day, so that in a way you tire them out during the day, so that nighttime they will sleep better. And then refusing to learn how to use phone. Yeah, okay, can. Yeah. So regarding using of the phone, yeah, I think that one usually, because sometimes elderlies they find it a chore or to learn new things, because sometimes new gadgets are much more complex to learn. Yeah, maybe you can try a simpler phone, maybe the ones with the buttons. Yeah, maybe you can try another alternative. Okay. Okay, so I think that will be the last question that we will be going to answer. Okay, so thank you so much everyone for listening to our talk. Okay, so now I'll pass the time back to Beng Hui.
Yes, thank you so much, Nabila and Wan Ring, for taking all the questions and for all your detailed answers. So if you've enjoyed today's health talk, we would really appreciate if you could scan the QR code on the left to fill in our feedback form. Let us know how we did in today's health talk. So we will be sharing the slides and the video link to your registered email. And we will also be uploading the video recording to our Tan Tock Seng Health Library and also to our YouTube channel. So the link to the health library is the one on the top right. So you'd like to revisit past health talks that maybe you didn't get to attend, and also access, we have over 900 health resources in our health library. Feel free to scan the QR code or enter the link below. And then also we have our upcoming event, Singapore Patient Conference on 18 October. This is a full day event. So if you'd like to find out more and register for the event, please scan the QR code as well. And you can also follow our Facebook page, and we also have an Instagram for our latest event updates. And then also, we'll be having the next health talk that we'll be having is on the 15th of September. So the topic will actually be on strategies against house dust mites. So if you're interested in this topic, you can scan the QR code and register for this health talk as well. So registration will close on the 13th of September. Okay, thank you so much for attending today's health talk. So if you need any more links or the QR codes, you can stay a bit longer, or we will share the links in the chat as well. If not, thank you very much. Please feel free to leave today's session. Thank you.